At this time, we'll be applying the technique of thoracolumbar direct MFR to our patient. This is a direct myofascial technique in which we're going to be hoping to affect that thoracolumbar area. With one hand, I'll be contacting the costodiaphragmatic region. With my other hand placed directly below it, I'll be contacting the upper lumbar region. This technique can have a very profound effect on this region as well as the diaphragmatic attachments anteriorly. With my hand that is contacting the costodiaphragmatic region for myself, with my fingers pointing superiorly, I will be applying an anterior and superior traction into that fascial layer. Whereas with my hand where my fingers are pointing inferiorly, I'll be applying an anterior and inferior traction into those tissues. So I contact those areas, the costodiaphragmatic and upper lumbar region. I apply anterior pressure until I feel that I am directly in that fascial layer. I apply a little bit of separation, superiorly and inferiorly, into those tissues. At this time, to further engage the direct barrier, I may add a little bit of clockwise or counterclockwise twist into those tissues, stacking the planes into the restrictive barrier, again going directly. Once I've reached that restrictive barrier, I will hold the tissues in this plane and await for a softening of the tissues and further compliance of the tissues, which would mark the end point of this treatment. To assist this technique, I may ask my patient to breathe in deeply and exhale, assisting me with respiratory cooperation as an activating force. Going further into the restrictive barriers, he inhales again and exhales, going further into the restrictive barrier. And at this point, I now feel a softening of the tissues, more compliance, and a feeling of release in the tissues. That is my end point. I could gently release some of my pressure. In order to retest, I can either again contact those tissues with that anterior force and just provide a separation with those hands superiorly and inferiorly, or I could reassess the somatic dysfunction in the manner in which I first found it.